Joining us now on the BC Couch, one of our favorites here from wisewomenmontreal.com. Lisa Brookman is here to talk anxiety. Welcome back.
Thank you.
Lisa, a lot of people hear anxiety and people say, oh, it's just a little bit of stress. First of all, how do you define, what is the difference between anxiety and stress, for example?
So stress is that normal emotional feeling that you feel, for instance, before you're writing an exam or making a huge purchase, that nervousness that you feel, and kind of comes and goes, but you're able to function. An anxiety disorder is really something kind of that takes over. It paralyzes you and you have an inability to function into day to day. It's that nervousness that just, it consumes you.
And so a lot of people are going to say, okay, I have anxiety about something, I just hope it'll pass on its own. When does anxiety, when does the anxiety disorder become a problem? What are some of the signs that you said it consumes you, but does it affect really everything?
It really affects almost every aspect. We say that our true anxiety disorder is diagnosed after kind of 6 months of almost daily nervous, anxious feelings where it's interfering in your day-to-day. So after about 6 months, if you're still kind of feeling that way, that's the time probably to seek support from a doctor or a mental health professional. And the interesting thing about anxiety is that it's not physical in its vision of you. So you don't really know if you see someone that's walking down the street that they might be struggling with anxiety.
Right.
So it's not something that you can see.
No, you never know what's going on in someone's head. We were just talking about this. A lot of people actually don't realize that anxiety disorders are a big umbrella for a bunch of other different disorders. Can we have some examples
Definitely
of those?
Something like OCD or anorexia, bulimia. Those are also anxiety disorders,
yeah.
and they kind of manifest in different ways. Panic attacks, anxiety attacks. These are all
people who don't know how to deal with that stress have it. Maybe is that a way for them to manage it by doing these little rituals and these different things?
Yes, and it's a form of control
yeah.
and things like that. But that anxiety, it just is paralyzing.
So we were talking about this as well. So if you have someone in your life who has an anxiety disorder, what are certain things you shouldn't do or shouldn't say to them?
Okay, well, I happen to have someone very close to me who suffers from anxiety,
yeah.
and I try to kind of balance, what I should and shouldn't say. Get over it. There's nothing to be nervous about. I know how you feel. I've been nervous too. Those are probably things you should probably stay away from saying.
Not helping.
Also, pinpointing when that person who's suffering from anxiety has a good day, kind of making a whole hoopla about, oh, you're doing so well today, you must be feeling better. That also negates that, the person could have a good day. It doesn't mean that they're not still struggling with anxiety.
So Lisa, after 6 months of continued anxiety, the takeaway here is consult. Go talk to someone, consult
yes.
a therapist or a mental health professional.
Yes, there's so many amazing treatments out there now. I mean, one of the leading one is cognitive behavioral therapy, CBT. It's amazing. It's looking how we can control our own behavior to kind of affect the way we act. Mindfulness is something that's wonderful, been around for a million years, and it's amazing. Relaxation techniques. And sometimes medication is a really good path to take if you feel like the other options are not working for you.
Lisa Brookman, always very interesting to talk, very informative to talk to you as well. Wise
Thank you.
Women Montreal, check it out. Thank you again.
Thank you.